Welcome to Mr. Doctor today. Today's case shows a detailed big tartar removal, a full deep cleaning procedure that brings back the nature of beauty of the teeth.
Tartar doesn't appear suddenly. It forms quietly, layer by layer, from the moment we finish eating. Everything starts with plaque, a soft, invisible film of bacteria that coats the teeth. The moment food particles, sugars, and saliva mix, plaque begins to develop. If it isn't removed within 24 to 48 hours, it starts hardening into tartar. Think of plaque as the wet cement and tartar as the final hardened concrete. Once it becomes tartar, you can't brush it off anymore. That's the point where professional cleaning becomes the only solution. And this is the part most people don't know. Even people who brush daily still get plaque in areas their toothbrush can't reach. Between the teeth, under the gums, behind the molars, these spots are breeding grounds for bacteria. As plaque sits there, it calcifies, turning into that yellow or dark brown crust that wraps around teeth. This is how tartar begins. Slow, sneaky, and always building up in the background. When tartar forms, it doesn't just sit on the enamel. It traps bacteria under the gum line. Those bacteria release toxins that irritate the gums. That irritation becomes inflammation. Inflammation becomes swelling. Swelling becomes bleeding. And bleeding is the earliest sign of gum disease. Many people think their gums bleed because they brush too hard, but the truth is simple. Healthy gums do not bleed. They bleed because tartar has already formed a barrier around the teeth, blocking proper cleaning. Once that barrier grows thicker, it pushes the gums down. That's how gum recession starts. The gums pull away from the tooth, creating pockets. And inside those pockets, more plaque, more food, more bacteria, more tartar. It becomes a cycle that slowly destroys the foundation of your teeth without causing pain until it's too late. When patients arrive for a professional cleaning, most of them have no idea how much tartar is packed under their gums. What looks like a harmless yellow stain on the front tooth may actually be a large mass of hardened calculus underneath. This is why every cleaning begins with an examination. The dentist checks for gum depth, inflammation, pocket size, and bone loss. They look for teeth that wiggle slightly, gums that are shrinking, and tartar that is embedded deep. This inspection reveals the true damage, sometimes years of buildup hiding behind a simple smile. Only after this full assessment does the real work begin. The first tool used is the scaler, either manual or ultrasonic. The manual scaler is a sharp metal hook used to scrape tartar directly. The ultrasonic scaler uses high-frequency vibrations combined with water. This tool cracks tartar off like breaking stone. The sound is sharp, almost like scratching glass. Many viewers find it satisfying because the transformation is instant. When the scaler touches the tartar, you can see pieces breaking off and washing away with the water spray. Those thick, crusty layers finally loosen and fall. It's the moment people love watching. The dirty, hardened buildup peeling away to reveal the natural tooth underneath. Surface tartar is only the beginning. The dangerous part hides below the gum line. This is where deep scaling happens. The dentist slides the scaler under the gums, reaching areas where brushing can never reach. They gently scrape the walls of the pocket, removing bacteria, hardened calculus, and stagnant food particles packed tightly around the root. Some pockets release a foul smell. That's the bacteria that's been trapped for months. or even years. When deep tartar is removed, the gums immediately look different. The color brightens, the swelling drops. The tissue relaxes because the irritation is gone. Many viewers underestimate how much tartar can affect a person's appearance. Thick tartar deposits make teeth look shorter, darker, and more crowded. After removal, the teeth often look longer and cleaner because the tartar that was hiding the real tooth length is finally gone. That's why some people think their teeth became longer overnight. In reality, the dentist simply removed what should never have been there. After the scaling phase, polishing comes next. This step smooths out the tooth surface. Scaling can leave microscopic scratches on the enamel. Polishing removes these and makes the enamel slick and shiny. A smooth tooth surface is harder for plaque to grip onto, meaning tartar forms more slowly. The gritty polishing paste acts like a gentle scrub, restoring the tooth's natural brightness. After that, a fluoride treatment may be applied to strengthen weakened enamel. This step is crucial for people with sensitive teeth or early signs of enamel erosion. Fluoride helps rebuild minerals lost from daily acids found in food and drinks. Now let's talk about what makes tartar come back so quickly. Plaque starts forming within hours after cleaning. Your mouth never stops producing it because bacteria are always present. What determines how fast tartar forms is your habits. If you eat sugary foods often or frequently snack throughout the day, bacteria feed constantly. The more they feed, the more acid they produce. Those acids irritate the gums and break down enamel. If you don't floss daily, plaque sits untouched between the teeth. The most commonplace tartar forms first. If you drink a lot of coffee, tea, or smoke, tartar hardens faster and stains darker. That's why smokers often have thick, dark calculus stuck behind the lower front teeth. Diet is another major factor. Sticky foods like dried fruit, chips, and pastries cling to the teeth and fuel bacteria. Sugary drinks coat the mouth even after you finish drinking them. These sugars turn into acids, and acids create the perfect environment for tartar. Water is the most underrated cleaning tool. Drinking water right after meals helps wash away food particles before bacteria can feed on them. It's simple, but extremely effective. Another important point, brushing alone is not enough. A toothbrush can only reach 3 sides of the tooth, front, back, and top. The tight space between teeth is untouched unless you floss. That space is dark, warm, moist, and loaded with food particles. It's the perfect breeding ground. That's why flossing is non-negotiable if you want to prevent tartar. Mouthwash helps with bacteria, but it does not remove plaque. Only physical cleaning, brushing and flossing, can remove it before it hardens. Regular dental checkups are not optional. Even with perfect home care, plaque will still accumulate in areas you can't see or reach. Most people need a cleaning every 6 months. Those with gum disease need it every 3 or 4 months. Skipping these appointments means risking
That was today's big tartar removal. If you enjoy watching, don't forget to like, subscribe, and stay tuned for more satisfying dental transformation. Only on Mr. Doctor.